Welcome to Autism Daily, everybody. Welcome back to all of those that have been here before. What does a multidisciplinary approach to treating autism mean? This is, again, one of those questions we often get asked. People talk about it and, everybody says that this is the right route to go, but what does it ultimately mean? So autism is a developmental disorder. If you've listened to previous Autism Daily talks, you'll know that, this thing called autism spectrum disorder affects each child very differently. And it can include impaired reciprocal social interaction and impaired verbal communication. It can include physical language, or impaired language. There's impaired nonverbal communication. There's social and emotional difficulties that children with autism can have. Many children have an abnormal response to sensory stimuli. These are all parts of early childhood development that children with autism struggle with. But we can't forget that child, even though these are elements that they struggle with, need to also still learn. They still need to learn normal childhood development. They've still got to go through all those milestones. The 2-year-old has to be able to button their shirts and point, and in order to one day hold a pen properly, you kind of need to be able to point at certain things, and there's a whole lot of early childhood development elements that we need to consider. Let's look at those. So let's look at everything that a child really needs to learn. We need to look at social and emotional development. We need to look at cognitive, perceptual development. We need to look at physical development, literacy, language development, numeracy, skills for daily living. All of these form part of early childhood development, and these are all core development principles. So when we look at autism intervention, we cannot, as parents or as therapists or as schools, focus only on one element of the child's development. So yes, we understand as educators, as therapists, me personally as a parent, how important it is for us to give our children language. But moms and dads, that's not all we can focus on. We need to focus on everything. Otherwise, you end up spending 4, 5, 6 years focusing all your attention only on, maybe, I don't know, breaking a flapping behavior. And where does that leave your child? You again leaving your child with a developmental delay, because what about the early writing skills? What about, the early number recognition and the early skills that the child needs one day needs to develop when they're 2 and 3 and 4 and 5, so that when they're 6 and 7 and 8, they can do mathematics and they can do literacy. So a multidisciplinary approach is really looking at the core development of the child. So look at all the elements of the child's development and focus equally on all of them. So yes, we have to learn our 1, 2, 3s and our ABCs and our colors and our shapes, and we've got to cut and we've got to do all of that, whilst we address the very real challenges that our children have. And, we can go back to the previous slide and we can say, what are those? Those are, social interaction, how the child relates to the world around them, communication, both verbal and nonverbal, language, restrictive activities or repetitive behaviors that's causing the child distress. For many, it's going to be things like attention deficit. It's going to be other elements like the physical side. So maybe there's low muscle tone that needs to be addressed, and that's going to be addressed with a physiotherapist and an occupational therapist. Speech is going to be addressed with maybe it's a speech therapist. Maybe it's an ABA therapist, maybe it's a school, maybe it's hearing. There's a whole lot of elements that we need to look at. We need to look at giving the child the best opportunity that they possibly can. And the best way in which we feel we can do this is by introducing a multidisciplinary approach to the treatment or the intervention of your child's autism spectrum disorder. I hope that this has answered your question today. We look forward to answering a few more tomorrow. Have a good day and take care of you.